Hello everyone, welcome to my channel Ravi Static Video. So in the series of pharmacology, we are moving further and take another topic which is also important for university examination, which is anti-adrenergic drugs. So how you can write in university examination? So let's discuss. So what the meaning of adrenergic drug? So it is the action of the releasing of adrenaline hormone, or also the like neurotransmitter of the action in our body. So it will be released too much in our body. So if I will take in some medicine, so it will block the action of the medicine. So the drugs block the effect of action that occurs by release by of adrenaline are called anti-adrenergic drugs. These drugs are also called adrenergic blocking agents, adrenoreceptor antagonists. So that are some synonyms, and it blocks the signals of the adrenaline hormone or like neurotransmitter, whichever have to be over released in our body. So there is some classification of adrenergic drugs. So like alpha adrenoreceptors blocking agent, so it blocks the signal of alpha receptors in our body, like parazosin and yohimine. There is two medicine to block the alpha receptors in our body. So the what is beta adrenoreceptors blocking agent like atenolol and butosomine. So the beta cell is present in our heart, so it will be increase the heart action. So if the contraction is too much present in our heart, so it will decrease the contractility of heart or decrease the heart rate and decrease the cardiac output if there is any kind of severity present or like over cardiac output present in our body. So there are two medicine, atenolol or butosomine. There is two medicine for taking on that time for decrease the heart rate. And alpha adrenoreceptor blocking agent, the alpha adrenoreceptor present in our like heart muscle or spleen. So if there is increased action happen in our body, so it will decrease the heart cell, bladder movement, bladder control, too much urine present in our body, elimination. So it will be decrease the bladder, uh, like bladder movement or like heart movement or like liver movement, that kind of action. If you are taking like parazosin or yohimbine kind of medicine, both alpha and beta blockers. So why beta blockers are present in our heart, beta cells are present in our heart. So if there is any kind of too much heart contraction or like high heart rate is over the time, if patient is suffering from high bp, so labetalol or carvedilol, there is two medicine have taken on those patients. So what is the pharmacological action of these medicine? So it affect the cardiovascular system or decrease the blood pressure. So if the patient is high bp, so the trigger point is like bp is high, so we are taking like labetalol, there is medicine for decrease the blood pressure. And on the eye, so eye is meiosis, so it will be occur on eyes. And nasal congestion, it means if there is too much blockage over the scutum in our nose area, so it will be open the nose, like agonist action of the nose, and will be really like dilate the nasal area and excrete out the scutum or like this discarded material in our body by the nose of like scutum. And the increase intestinal mortality, it means the decreased gi mortality or intestinal mortality. So it will be helpful for intestinal activity to increase them, and like easy to digestion of the different food material in our body. Inhibit ejaculation, it means there is too much nightfall will occur in our body, and there is no any kind of stopping things in our body main receptors. So it will be taken on the alpha adrenoreceptor blocking agent. So it will be block automatically in our ejaculation in our body, or delayed ejaculation in our body. Like indication, which time we have to take these medicine of anti-adrenergics, like to treat the hypotension. It means the patient have too much have bp, so it will take on those patient. In congestive heart failure, it means there is a blockage is present in our heart muscle, so it will be taken on those patient this medicine. In migraine, the patient is suffering from migraine like headache or in the upper sinus region, so it will be medicine taken by taken by the dose time, so it will be ease your pain or relieve them. Contraindication, so like which time we are not taking the medicine. So alpha blockers and contraindicated in hepatic and renal disease. So if patient is suffering from kidney disease or like hepatic in liver disease, so those time is inability to show the action of kidneys or liver. So those medicine we are not taken, it is contraindicated for that, because the action is already low, so it not increase their action, it will be decrease their action, so it is contraindicated for those. And also the peptic ulcer, so if patient is taking medicine, so it will be enhance their ulcer action, and internal bleeding also occur. Drug allergy, some person have anti-adrenergic drug sensitivity or allergic reaction happen in our body, so it will be can't taken on those patient. Next is to be alpha 2 blocking agent like yohimbine increase the insulin secretion and down the blood glucose level. So if a patient is suffering from diabetes mellitus, so yohimbine, there is one machine. So in there is type 2, it is helpful for type 2 diabetes mellitus. So the patient is taking the yohimbine drug, so it will helpful to increase the insulin production in their body and the down the glucose level in the blood or the circulatory system. Next is to be beta blockers. There is a selective beta 1 blockers, atenolol or bisoprolol, selective beta 2 blockers, butocimine, non-selective beta 1 and beta 2 blockers are propranolol. So there is some example of medicine, so it will be taken time to time, on depends on the patient to patient vary. Like beta 1 is cardioselective blockers like atenolol, bisoprolol, these are used to treat hypertension patient. So on that time we are showing the patient who have suffering for hypertension, so atenolol, bisoprolol, there is two medicine for decrease the blood pressure, and it is the also known as the cardioselective blockers. Next is to be non-selective beta 1 beta 2 blockers like propapripanol, there is medicine to decrease the heart rate, also the contractility rate of the heart, so it will be ease the function of the heart rate, smoothly action will be occur in our heart. Next is to be pharmacological action of the anti-adrenergic drugs. So it will decrease the heart rate, if person is high bp and high heart rate, it will decrease that. And also the bronchoconstriction what, so if patient is having a sputum in their lungs, so it will be easy to excrete out by the nasal area, and also they relax them, so after that it will be ultimately bronchoconstriction will be occur. Next is to be vasoconstriction. So if patient is suffering for high bp, so labetalol or uh, there is all other medicine is like atenolol, the two medicine they relax the heart muscle and excrete out the a plaque formation of their heart arteries, so it will be also ultimately the relaxing of the heart muscle and the vasoconstriction will be occur. Next is to be glycogenolysis, so it will be increase the glycogenolysis, there is one medicine yohimbine, so it will be increase the insulin production and decrease the glucose sugar level into the body. So the glycogenolysis is the production of the ATP in our body for the proper functioning. Next is to be indication, so which time the patient is taking like beta blockers, so like hypertension, angina pectoris, cardiac arrhythmias, migraine, anxiety, Parkinson disease. So if there is any kind of situation, so beta blockers will be taken on those patients. And if alpha and beta, two kinds of blocker medicine, so there is example is labetalol and carvedilol, these are used to treat high blood pressure. So if patient is suffering for high blood pressure, so there is two medicine or there is another drugs also available. So labetalol is the very famous, and the example if there is patient suffering for high blood pressure, so they can taken taken by the labetalol medicine for the ease the heart muscle to relax them and decrease the blood pressure. Doses like atenolol is 25 to 100 mg daily, propanol is 82 to 40 mg to 12 hours, and labetalol is 200 to 600 mg is 12 hours. So that is the anti-adrenergic drug taken on the patient. It depends upon the disease like hypertension, angina pectoris like chest pain, cardiac arrhythmias, abnormal heartbeat, migraine is severe pain in headache like in our head, Parkinson disease like autoimmune disorder, and severity decrease destruction of the nerve cells and the anxiety of the in our body, so that the medicine will be taken by the patient with different situation. Thank you.